Do these things work? How about these things? Hey there, Concussion Doc here, Dr. Cameron Marshall, President and CEO of Complete Concussions, which is the largest concussion care network in the world. We provide training for healthcare professionals on how to better manage concussions, as well as some software tools for concussion testing to schools and sports teams and those types of things. Today, we're breaking down the Guardian cap as well as the Q collar. What does the evidence say? Now, first thing we need to understand is what a concussion is and how a concussion happens, because then we can make the theoretical kind of observation for whether or not these things should work, and then we'll look at the evidence to see if they actually do work. So, how does a concussion happen? Well, a concussion is due to acceleration and deceleration of the brain inside the skull. If you look at this GIF here, we can see that we get this fluid wave. So upon impact, the brain is going to move around inside the skull. And if you can see this fluid wave that starts here, like that, now picture every little brain cell inside getting stretched as that acceleration, deceleration event happens. So we picture a brain cell like this. It's a long kind of tubular structure, but it actually has holes in it. Now those holes are very small, so things can't get in and out. But when you have an acceleration force and the brain cells get stretched, the holes, those little pores inside the neuron actually expand, and now they are big enough. So what you get is an ion exchange. When you get ion exchange, potassium leaving the cell, sodium and calcium rushing in, you actually get action potentials. So very simplistically, all a concussion is the brain cell getting stretched and then creating ion exchange, which then causes the brain cell to fire. So now millions of brain cells all start firing at the same time, and this can cause any number of immediate signs and symptoms, right? Balance impairment, loss of consciousness, seeing stars, they may be confused. It's because there's so much activity going on in the brain, they can't make sense of what's going on in the world around them. Now then, kind of the downstream effect of this is that when those brain cells fire, they release excitatory amino acids or neurotransmitters. Those amino acids bind with these NMDA receptors here, and those NMDA receptors act as calcium channels. So we already get calcium coming into the cell, but now because of that firing, those signals are getting passed on to other neurons that may not have been affected by the initial injury, and what you're getting here is calcium flooding into the cell, and it gets into our mitochondria. Our mitochondria produces ATP. So now, because we've created this ion differential, we need to reset the balance, and we do that through the sodium-potassium pump, which requires ATP. But we're not making as much ATP. So essentially what you get after a concussion, and the downstream effect, is you get increased ATP use, but you get decreased ATP production, and then you result in this kind of energy crisis. And that energy crisis starts pretty much right away. So this is a study done in mice, and you can see ATP here on the y-axis. We have time on the x, and within 1 minute after injury, we get a reduction. 10 minutes, 30 minutes, 2 hours, we hit significant difference. 6 hours in a mouse, we hit our peak low, and then we gradually start kind of restoring back up. Now, how much force does this take? Well, we see here from the biomechanical literature that to cause a concussion from a linear acceleration standpoint, you need about 100 Gs. So you can see most of these studies here, there's a range between about 70 up to 132, but the peak mean linear force is usually around 100 Gs. And then you have rotational acceleration as well, and that's usually around 5,000 rads per second, but you have a range from about 3,500 up to 7,000. Now, why don't helmets prevent concussions, right? We have to understand what a helmet does in order to understand whether or not a Guardian cap might actually help us in any way. Well, because a concussion happens from the brain moving inside the skull, wrapping the outside of the head with something isn't going to really help, because once the helmet gets hit, the head movement is what actually causes the concussion, right? It's not the hit to the head that causes the concussion injury. It's the movement of the head that causes the concussion injury. So even if you have a helmet on and you get hit and the head moves like this, and as long as it moves fast enough and there's enough acceleration, the brain inside is potentially getting stretched and we're getting that ion exchange and concussion can occur. Helmets, however, are meant to prevent skull fractures. Now, if we picture this, if we have a baseball coming to the side of our head and it hits a bare kind of head, it's going to hit at a very small focal area. And because you have a large amount of force hitting at a very small focal area, it can actually crack the skull, and then you get skull fractures. But if we put a helmet on the outside, what you're doing now is you're actually dissipating that force. So now all of that force is being spread out over a larger surface area. So the helmet is designed to prevent skull fracture. You may crack the helmet, but you're not going to crack the skull because now that force is distributed, and you can see here how it gets distributed to a larger surface area, and that prevents skull fractures. That's what helmets are for. But what happens to the brain inside the skull? When that head gets hit and the head moves like this, as long as there's enough force to move it, you're still going to get the concussion injury that happens. So the helmets do nothing to prevent concussions. It's the brain moving inside the skull. So then theoretically, why would wrapping an additional layer of protection on the outside of the skull do anything to prevent concussion injuries? Well, that's the whole idea behind Guardian Cap, right? The idea is that if we add more padding to the outside of the head, then that's going to basically reduce the amount of head acceleration because there's a softening of that. You're essentially trying to increase the time variable. So acceleration is the change in velocity divided by the change in time. So because time is the denominator, if we can increase the amount of time that elapses for that deceleration to occur or acceleration to occur, for that change in velocity to occur, I should say, then you're going to reduce acceleration by a significant degree. Think about airbags in your car. So when an airbag goes off, right, you're in a car accident, your head is going to whip forward really, really fast and potentially hit a stationary object like the steering wheel or the dashboard. Now, if that airbag comes out, it now increases the amount of time it takes for you to hit that, and it slows you down in a more gradual way. So the acceleration or deceleration in this case is actually much less because you're increasing the time variable. So the idea is if we put padding on the outside of the helmet, and now when that impact happens, there's a bit of a cushion that can potentially increase that time variable. Now, can a Guardian Cap actually do that? Is there enough padding there to be able to actually do that? Well, if we look back at a study here from Viano, this is a finite element model from back in 2007. And what they did is they took NFL impacts and they looked at video replay of those impacts to see how much acceleration was incurred, how much movement of the head, also how much time it took for that acceleration value to maximize. It happens very quickly, just FYI. But then they started playing around with the variables. What if we changed the thickness of the padding inside the helmet? What if we changed the material that the helmet was made out of so that it could absorb the shock better? And what they found was no matter what they did to the helmet, the head would still accelerate to a significant degree. So the solution wasn't in the helmet. What they did find, however, is that if we increased the stiffness variable of the neck and we didn't allow the neck to move, that significantly reduced the acceleration of the brain. Why? Because now it connects brain and head to the body, which creates a long moment arm. So if you try to hit the head, if it's all connected, now you have to move the entire body to move the head, and that's going to move very slowly. So you're decreasing acceleration because of that long moment arm. But if the neck is allowed to move freely, you can wrap the head in whatever you want because it's the impact and the head whips. That's where the acceleration of the brain happens. And we see this in other sports. For example, if we use soft-shelled headgear in soccer players or rugby players, there was a large systematic review that was done that looked at this. They found that every single study did not show any reduction in concussion risk, with the exception of one study. So the conclusion here is that headgear was not associated with reduced rates of sports-related concussion or superficial head injury in youth soccer and rugby. Right? So, and they actually found increased injury risk to those wearing headgear. So maybe they play differently. Maybe they expose themselves to more risk-taking behavior if they're wearing the headgear. But putting something on the head in soccer and rugby does not reduce concussion risk. Why? Because it's the brain moving inside the skull. You're still going to have that translation of the head. No matter what you have on the outside of the skull, it's not going to reduce it. So why would we expect to see anything different in something like the Guardian Cap? Well, let's look at the research and see what we actually find, right? We see these players in the NFL wearing these things. Well, they must be wearing them for a reason, right? Let's look at the research. So we only have two main studies really that have looked at this. The first one is from I think it's Secchi in 2022. And what they did is they did this study in a lab, and they also did it in the real world. So you can see here they had these kind of impact things where they would impact a bear helmet, or they would impact a helmet wearing the Guardian cap, or they would have two Guardian caps coming together. And they looked at it from different angles, looked at rotational acceleration values, and looked at linear acceleration values. Now, if we look at this, we can see here that if the dots are below this reference line, that means that the helmet padding or the Guardian cap did better than the bear helmet. So for linear acceleration, this is peak linear acceleration, this PLA, you can see that there was really no difference between the helmet with the padding or the helmet without the padding. The acceleration values were the same. However, for rotational acceleration in the lab, they actually found that the padded helmets did better. And they also found for these other variables, which they called damage and harm, which are basically like different kind of things they made up for head acceleration values. They found that the helmet padding did better for the damage variable as well as the harm variable. So in the lab, the helmet padding performs better than a bear helmet. But then in the real world, they put them on, and you can see the differences here. Peak linear acceleration between players wearing the headgear and players wearing just a bare helmet. There's absolutely no difference whatsoever. You can see here for peak angular acceleration, no difference whatsoever. You can see here for the damage variable and the harm variable, no difference whatsoever between those two things. So we have to understand that what we see in the lab is not what we see necessarily in the real world. And what they found here is that the lab results suggest that the padded helmet shell covers have the potential to reduce angular head accelerations. However, it didn't happen in the real world. And even in the lab testing, you can see that they did it at different velocities. So at 3.5 meters per second, which is more of the subconcussive range, it was able to reduce the harm variable by 25%. However, at the concussion ranges, 7.4 meters per second, it was only able to reduce it by 10%. So it seems to be more effective at lower impact magnitudes, not as effective at the concussion range of impact magnitudes. Now, there's a second study here from Synod in 2024, and they also looked at peak rotational and linear acceleration, and they compared people wearing the Guardian cap to those that weren't. They put accelerometers in the helmet so they could see how much acceleration variables or values were actually happening, and then they compared them. Are the players wearing the Guardian cap having less head acceleration than those not wearing the Guardian cap? And what they found was that there was actually zero difference. So again, we see another real world example where the Guardian cap does nothing to reduce head acceleration in a real world scenario. So overall, peak linear and rotational acceleration between the shell and the control groups were equivocal across helmet location, observed direction, starting stance, and closing distance gameplay factors. Conclusion, protective soft shell padding did not reduce head impact kinematic outcomes among college football athletes. So we really have no evidence that these things work at all in a real world scenario. And so the conclusion here for the Guardian cap is that it seems to potentially offer some reduction in rotational acceleration in a lab setting. However, there's no real world evidence that these actually reduce head acceleration at all. Okay? Now, another thing that we should consider with these Guardian caps is that if concussion is due to the movement of the brain inside the skull, and the main thing that matters is being able to keep our neck stiff to reduce that amount of movement inside the head. The number one thing for being able to control our neck is how much weight is on our head. So if we add more weight to our head, are we actually reducing our ability to control the head? Especially when we think about kids. Kids are already bobbleheads. Right? I think by age like 4, the kid's head is 90% fully grown, whereas their body is less than 50% fully grown. So you have these big heads on these small frames, and then you put a football helmet on them, and then you put a Guardian cap on top of that. How much more difficult is it going to be for that kid to control and stabilize their neck in an impact setting? So I think that's something we have to consider, because kids are going to see these athletes wearing them. Parents are going to see them and be like, oh, great. We're going to add another layer, so that's going to prevent concussions. But is it actually making it worse, especially in kids? That we don't know. So I'd be just really cautious about implementing these things just because you saw it on TV, especially in a young kid. We have no evidence in kids. We even have no evidence in adults, yet, we're doing this. Whether that's a PR move or not, I'm not sure. Now, moving on to the Q collar. The Q collar, as you can see right here, is a device that goes around the neck and compresses on the jugular vein. Okay, well, what would that do? How does that do anything from a concussion standpoint? Well, the idea here is that by compressing the jugular vein, we actually reduce the amount of blood that's able to leave the head, right? So the jugular vein is how the blood from your head gets back into your body, right? So it goes up through your carotid arteries and a couple other arteries in your neck, and that goes into your brain. And then the veins that go back to your heart come down, and that's the jugular vein. So if we put pressure on that jugular vein, we decrease the amount of blood that's able to return, which keeps more blood in the head. And what that's going to do is cause more kind of slight swelling of the brain, which makes the brain bigger. There's more fluid around the brain and potentially cushions it. So in the event that the head gets hit, the brain has cushioning around it, and so it doesn't move as much. I'm going to play this kind of marketing video from Q collar so you can see exactly what I'm talking about here. So you can see here we compress the jugular vein, so the blood now develops this fluid layer around it, and now when the brain gets hit, potentially there's cushion around the outside of the brain. So in theory, this actually has a little bit more theoretical promise in my mind than the Guardian cap does. Because wrapping the head, we know, doesn't really work. That's not going to be a viable solution. But potentially doing something like this that actually protects potentially the brain inside seems like a better option. However, theory and reality, as we've seen, are two different things. Now, one kind of element that we can use here is altitude. So what happens at high altitude is that you also get a change in cerebral blood flow, and you get slight swelling of the brain at higher altitudes. And so there's studies been done to see if concussions happen less at higher altitudes. Now, there was a study by Zavorsky in 2016, and they looked at the difference between high and low altitudes on concussions. They did a meta-analysis where they looked at a number of different studies that looked at this exact question. And what they found was that there was no clinically relevant association between altitude and concussion risk. So again, here's a scenario where you have slight brain swelling at higher altitudes, yet we have no real reduction in concussion risk. So would the Q collar be any different? So there's only been a couple studies done on the Q collar. Well, there's been a number of studies done on the Q collar, but the ones I'm going to talk about, I'm putting in two here because one is actually a systematic review, which looks at 15 different studies. So this first one I'm looking at here is they're looking at female soccer players wearing the Q collar versus those not wearing the Q collar over the course of an entire season. Now, one thing to keep in mind is that one of the authors of this paper is an owner of Q collar. And so there's going to be some financial incentive to make sure those results are good. And if they're not good, maybe we don't publish it, or maybe if they are good, we do publish it, right? So there's always bias in these types of studies. When you look at who the authors are and what their affiliations are, if you notice that one of the authors is actually an owner of the company or a founder of the company, you have to be a little bit skeptical of what's going on there. There's a bias there. So anyway, what they did, they had 48 players involved in this study. 27 of them wore the collar. 21 did not wear the collar. Then they did pre- and post-season fMRIs, functional MRI studies, to look at kind of brain blood flow. That's what they do. And they look at brain activation patterns. So they'll have them do a specific task inside the fMRI, and they'll look at which brain regions kind of light up to show you which areas of the brain are active. Now, they found no differences between impact exposure, so both groups got the same number of impacts throughout the season. They found no difference in pre to post season in terms of their cognitive function between the groups. So there's no change in their cognitive function, whether they were wearing the collar or not wearing the collar. However, what they found is that the group not wearing the collar actually had changes in their fMRI from pre to post season. The group wearing the collar did not have changes from pre to post season. So then their conclusion is that this mitigates the subconcussive effects over the course of a season. So by wearing this device, you're not allowing as many changes to the brain to happen on their fMRI. Now, I think that's a leap because we don't know what these changes actually mean. Maybe changes are good over time. Maybe these changes are somewhat adaptive over time. We don't know what they mean. And so saying that just because you did have changes or don't have changes, that that's a good or bad thing, we actually don't know that. So in my mind, that's a leap, right? And also when it comes to subconcussions, we don't have any good evidence that subconcussive impacts are a problem at all. There's theoretical idea that maybe they are, but we actually don't have any good evidence that they are. There's all sorts of studies that show no changes in cognitive function, no issues at all versus contact versus non-contact. So there's a lot of question marks here. But when we look at it from a concussion perspective, so this is a systematic review done in 2024, and there was 15 studies that they looked at, and what it should be noted here is that the founder of Q-Collar was involved in 7 of the 15. So there's going to be some bias in those. However, when compared to the control, the results across the board indicated that jugular vein compression resulted in significantly reduced white matter alteration, improved short-term neurocognitive outcomes, increased internal jugular vein cross-sectional area, which I don't know if that matters, and decreased internal carotid artery cross-sectional area, which again, I don't know if that matters. But there was no significant difference in concussion rates between the groups that wore it versus the groups that didn't. So at best, it may be able to have some of these impacts on some of the imaging modality findings, which we don't even know what they mean. However, we don't have any reduced concussion risk. So again, we don't know what these changes mean. Maybe these changes are good to have. And by wearing this collar, we're actually preventing some certain adaptations that we require as part of growth, aging, or even just physical exertion for that matter. We don't know. So, and these changes also happen for a number of reasons that are not related to concussion. We see differences in diffusion tensor metrics, which is one of the things we're looking at, in patients with anxiety. We see these changes in people with post-traumatic stress disorder. We see these changes in people with, pain or chronic pain or different, an injury of some kind. If I hurt my leg, my diffusion tensor image is going to change. So we don't know what this means, if anything at all. But what we do know is that both the Q-Collar and the Guardian Cap do not show any type of real-world evidence of concussion reduction. They don't seem to prevent concussions at all, right? And if you look at the marketing, it'll say, prevents the long-term damage due to repetitive head impacts. But we don't know if that's actually true because they're using imaging modalities that we don't really fully understand what those changes mean or whether they're good or bad, because they can't say it reduces concussion risk because they actually have no evidence to say that it does. So then why are we seeing professional athletes wear these devices if the evidence is pretty much non-existent to, very minimal at best? Well, there's a number of possibilities. One, they may just be scared. Right? I want to do everything I possibly can to reduce my risk. And so they may be wearing them just to say, I'm going to do everything I can, even though the evidence is weak. I might as well do it, right? There's no real harm to me doing it potentially, so I might as well try. Another possibility is maybe they're getting paid to. Maybe these companies have sponsored certain athletes to say, hey, look, if you wear this on TV, we'll, give you a promotional, incentive to do so. We don't know. And number 3, it could be that the NFL is encouraging this as a bit of a PR move. Hey, look at what we're doing to make the game safer, right? We got these big helmet things now, and the public sees that and goes, oh, look, they care. They're doing these things, even though the public doesn't understand that the evidence really isn't there to support them at all. So the point is, don't believe everything you see on TV. You should always make sure that the research actually supports it, and in this case, it really doesn't.